This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client here brought me her pelvic x-ray. And you can see that she appears to have developmental asymmetry in which the left hemipelvis is wider than the right hemipelvis. And with her standing and laying on her back and laying on her stomach, she has asymmetry of her pelvis. It's not subtle. And she tried several so-called sacroiliac alignment techniques, which actually are techniques to try to improve alignment of the pelvis. And the pelvis can move with the lumbar spine and the trunk, and it can move with the hips. And so when someone has an uneven pelvis, you cannot say that that's happening inside the SI joint, because rotation inside that joint is 2 degrees, and that is so small. And the glide is 2 millimeters, and that is so small, and that's in each plane of the body. Much too small for us to visualize with our eyes. The pubic joint is interesting. The right pubic crest, the top of the pubic bone, is lower, and it looks like she has increased width. And what I need to do is I'm going to measure her pelvis, then I'm going to blow up this image so that it becomes the same size as her pelvis. And then I'm going to measure the space at the very middle of the pubic joint. Per research, that's what you need to do. And normal width is about 2 millimeters, but she's had 2 children via natural childbirth. And so her norm might be 4 millimeters. That would still be considered normal for having delivered 2 children. But anyway, she has a pinching sensation in the area of her SI and has been under chiropractic care for 5 years and has had extensive physical therapy as well. And she only gets short-term relief with all of those treatments. And walking is difficult. If she walks more than, how much do you walk before it hurts?
Like 3
miles? Okay, and then what happens?
My back starts aching and just muscles get tired. My lower back aches and my right side more than the left.
Okay, are you able to sleep?
No,
it affects your sleep.
Yeah, it does affect my sleep.
Okay, and how about sitting?
Yes, when I sit, I feel uneven, and it hurts more on the right side and back.
Okay, yeah, and you've shown me, and it's in the region of your SI joint, a little bit in the lumbar area as well, and down into the buttock as well. And I know you have some anterior abdominal pain as well. But what I want to do is demonstrate to you my palpation testing and my movement testing of the pubic joint. And if she had a trauma, she had a tobogganing accident, and we could call childbirth a form of trauma.
Yeah.
We don't know what caused this shift in the pubic joint. We don't know when it happened. As a child, you could have had injuries. Who knows? Mm-hmm. So that's a mystery to us. The question is that a treatable problem or is it not? Okay. And I'll demonstrate to you how I evaluate movement and position of that pubic joint. And no doubt, if there is a movement fixation, if the pubic joint shifted downward and got stuck, well then no doubt then that affected your SI joint as well, because you have one joint here in the front of the body called the Symphysis Pubis, and then the bone goes all the way to the SI joint. Okay? And then here's a ligamented model. Grateful to my friend Robert Breton, who designed it and gave it to me. So again, if there's movement here in this joint, then there has to be movement in the SI joint. And here's a posterior view. The SI joint is comprised of the sacrum at the first, second, and third sacral level, and then the ilium. And so there is lower sacrum that does not participate in the joint. The joint is just up in this area, deep to those ligaments. Okay? All right, so please lie on your back. So she asked if her husband would have to treat her every day with this. And the answer is no. I believe that this will be a one-time treatment. I will, however, film tomorrow, show him how to test you
Okay.
to see if you need repeat treatment. My experience is that when you treat it correctly, the body accepts that treatment and it's a one-time correction.
Okay.
I don't pop the pubic joint. To me, that's not even gets to the joint because it's such a strong joint that popping feels good, but it's a negative pressure in the tendon sheath of the adductor longus muscle. It's not your pubic bone shifting. It takes energy and time, okay? And it takes about 5 minutes, between 3 and 5 minutes to get that to move because it is such a strong, strong articulation. So, the way that I palpate the top of it is I start from above, okay, with the heel of my hand. So then I'm off to the left, allowing some space for the midline, and I push in into the muscle and tendon, and then I come down towards the feet. And I see a distinct difference. Your right side is definitely lower. And if I move my fingers across, I fall down. If I move, yeah. So if I come across this way, I have to climb up. So there, that looks like a step down. But what if this is normal anatomy? Then there's nothing to treat. If there is no movement dysfunction identified, then there's nothing to treat. So you might ask, is the left side up? And the way that I make that discernment is I ask the question, can I very gently push to a stop point called taking up the slack, which I am at now, and then I'm going to give it a little thrust, and it moves. And the force goes through that joint, down the hip, down to the feet. I see your feet move. Okay? Can I do the same test on your right side? So I push through till there's a natural stop called taking up the slack, and now I spring it and I see movement in the feet. Okay? So far it moves down on either side, and now I'm going to go upward on the left. So I hook underneath and on the front face of the left pubic bone, and I push up to a stop point, and then I give a little tiny thrust, and it goes through that structure on beyond it. I saw your head move. On your right side, I'm doing the same loading, okay, to a stop point, and it stops real quickly. Okay? I'm going to spring it now, pushing towards your nose. What do you feel?
I don't feel anything.
I feel no movement.
No.
How much force am I using?
Quite a bit.
How does it compare to the force on the left?
I mean, the same, probably. More.
Okay, I think it's more.
More, yeah.
So because this does not spring upward, and the left side does spring upward, my conclusion is that this is a movement dysfunction. It is a shift. I don't think this is normal for you. You describe a pinching sensation in your SI on the right.
Right.
Okay. Do you want to lie on your stomach and point to where that pinching sensation is?
It's mostly right here. Like
Oops. Oops. All right, go ahead.
it's mostly right here,
All right.
and just the aching is right
Okay.
there and down.
All right. So I'm trying to locate your PSIS. Your PSIS is right there. Point again where it feels pinching.
Well, to me, it pinches right there.
Okay, so you're pointing right above the PSIS. So that's still in the region of the SI joint. That's your upper SI joint on the right. Okay, so roll over onto your back. So the question is, if I restore normal movement through your pubic joint, will that pinching sensation reduce? And that, remains to be seen.
Okay.
So the way that I treat it is I capture the front of the pubic bone and I get a little bit underneath it. Okay? So I spread out the force of my hand and then I push straight up. Now your pube lies at about a 30-degree angle. My finger is pointing at that angle. This is the angle I'm going to use to treat it. And I'm going to stay here for 5 minutes. So I'll stop filming. There's no reason to film me, doing this for 5 minutes. Okay. Is that thing under your head?
Yes.
Okay, good. So I'm going to keep your face out of the video. But I'm going to come up, just capture your ear. Is that okay?
Yep, that's fine.
All right, so we just have your ear and your shoulder and the back of your head in the video. The body has a compensation. If this positioning of the pubic is abnormal for you, if it's not your normal pubic position, if that's induced by a trauma, then it's going to alter your lower body posture. Okay? And a typical place where the body compensates, the body tries to go the other direction. So if you drop down on the right, then I would predict that your head is going to drop down on the left, and that's going to keep your eyes horizontal. Okay? So if that's true, then I can put my fingers under your mastoid, and I would predict that your left would be lower. It looks lower, but what I'm going to do is I'm going to spring it on the right side. So I'm lifting up, a little bit of a thrust with my index finger, probably 3 pounds of force, and I can make your head side bend left. Okay? I'm going to do the same thing on the left. Tell me what you feel.
It doesn't move.
It doesn't move. I'm using at least 5 pounds of force and it doesn't move.
Mm-hmm.
So this is a reflex, and because I find the restriction up here, based on my experience of 40 years, it tells me that the asymmetry down there in the pubic joint is not normal, that that's induced by an injury because this upper body reflex, this righting reflex, has come into effect. Okay? And I could work on these muscles, and I could stretch, and I could mobilize it, and manipulate it, and all of that stuff. It wouldn't work. Within 5 minutes, this would side bend left slightly because it's driven by the reflex in your body. The nervous system is controlling it. I cannot correct this. I have to treat the pubic joint and correct that asymmetry of position and movement in that joint. This will then melt. This will go bye-bye without me even touching it. Okay?
Every time I look at the pictures of myself, my head is always like...
Is that right? So
Yes.
so your head is always tilted down to the left.
I was always wondering why that is.
How interesting. Okay? Very good. So I'm going to stop filming and I'll set a timer for 5 minutes and then we'll come back and see what we achieve.